All, this is Dr. Mubin Sayed from DrBeen.com. Today we have received Kiweno's vitamin D test kit, and I wanted to demonstrate that with you. I have already used one of these kits to make sure that I understand how to use it. They had sent me 5 of them. These are not available in the US because they are not approved here. So the one that they sent me are for demonstration purposes. And what they had to do is that they had to send me a fawn as well, because the app is not allowed to be downloaded in the US as well because the test is not approved. So they sent me a pre-installed fawn as well, and I would have to send this back afterwards. So here is the box, and if I open it up, in the box here, so this is the pouch that contains the test kit itself, and here is the contents. This little box here contains the enzymes from them. This is a pipette and this is a lancet. Just be careful with the lancet. In the first go, when I used the lancet, I kind of destroyed it by firing it earlier away from the finger, and that caused it to be you cannot recaulk it. So that was the problem. So here we have these content. This is a pipette with which we are going to pick up the content. This is the lancet here, that for the, and then finally here is their enzyme. So enzyme and pipette is going to stay here. This is the lancet to have the finger pricked, and then they have a couple of more things here. There is a card in here which is for the calibration of the app if needed, and then they have sent an extra lancet as well. I think that is nice because I accidentally misused the first one and I could not reuse that one. And this is a little pamphlet too that you can use to read how to do the test. So now let's do this. What I'm going to do is, I have a volunteer here with me. There is the app. App is going to guide us for what are the steps to do. So first of all, prepare the test. And I'm going to say continue. I hope you are able to see it. So for starting, the first thing that they want us is to clean the finger and clean it. So the finger is cleaned, number 1. Number 2, then the app actually very decently tells you what to do. So the next step is to take this lancet and then rotate it and pull it out. So I'm going to rotate this guy and pull it out. Then in the next step, I have to now puncture the finger. And then clean the first drop, and then keep, sorry about this, and then as the blood comes out, so I think I have messed it up a little bit. I did that before too, and they said if there are bubbles it becomes invalid, but let's see if we can continue with this one. So after this, there is the blood drop here. Then collect these two together, press it, and then shake it so that the blood and the reagent, they are mixed. And so now they are mixed. Then what you do is, after shaking it, you continue and you take the vitamin D test out of its pouch. So here is the vitamin D test. You take it out, put it here, and then what you do is you remove this cap from it, remove this cap, and then drop 3 to 4 drops onto this thing. So I'm going to do it now. So 1, 2, 3, 4. So that is done. Then as we continue, now there is a 15 minutes incubation time, after which the test over here would show us the results. So I'm going to meanwhile pick up these things, and now we'll wait for this timer to expire while this test over here is developing. So if you'll see here very soon, there will be a line on control, and then there will be a line on the test itself. When I did my test, my vitamin D levels came out to be 19 nanogram per milliliter, which is insufficiency. It's not even normal range, it is insufficiency. And I take vitamin D regularly. So there is an issue. Either the test is not that great, which I think test is fine. It is something to do with my levels as well. So I need to figure out if I'm not able to absorb them correctly, or if I am not taking enough levels, or if it is going to take too much time. And as you can see that the control line here is now developing, and the test line is not yet developed. It would take about 15 minutes of incubation time for the test line to start developing as well. Alright, so we have now left with 3, 2, 1. So now the app is ready to actually look at the scan it. So I'm going to press scan, and there are 2 minutes to help with the scanning. Alright, so the volunteers test result is 19 nanogram per milliliter, 29 nanogram per milliliter, which is almost at the normal range. It is 30 nanogram per milliliter is the normal range.